Well, hello there. This is Professor White, and today we're going to talk about drugs that are used to treat parasitic infections, including malaria, protozoa, and helminths. Let's dive right into malaria. So malaria is the most significant protozoal disease in terms of morbidity and mortality. There's estimated 350 to 500 million people infected with malaria. Now, the new cases and the deaths have actually fallen dramatically from the beginning of the century, but there's still up to 2 million deaths annually. This is an infection that is found generally in sub-Saharan Africa, Southeast Asia, Latin America, and those areas that are around the equator. Not too many cases in the United States, but we may see that changing as we continue to experience the effects of climate change. Malaria is a protozoal infection. It is transmitted by mosquito bites. So what happens is that a mosquito gets infected with the malaria parasite when they bite an already infected human or animal. And then it's also transmissible by blood transfusions, through childbirth, and from sharing needles. So any of the same ways that we would get other sorts of bloodborne infections, one could transmit malaria as well. You're probably aware that a mosquito is actually an insect, and insects do have their own insect sexual life cycle, and that is basically what we are used to seeing when mosquitoes lay eggs and they hatch. However, if the mosquito is infected with Plasmodium, or the malarial parasite, there's the asexual cycle of reproduction for the parasite that we need to be aware of. The medications that we have generally only treat malaria inside the human host. And knowing that the mosquito life cycle is and how that works is how we can interrupt transmission and also treat the host. So the asexual phase actually occurs in two phases. So let's take a look here. So basically, the asexual phase of the malaria parasite's life cycle occurs within the human host, and it has several stages. Infection, first of all, is when the infected female mosquito bites a human and it injects sporozoites into the bloodstream. Those then travel to the liver and invade the liver cells, where they mature into something called schisons. Those schisons rupture and they release merozoites into the bloodstream. At this point, all of that was considered the exoerythrocytic phase. The erythrocytic cycle happens once those merozoites invade the red blood cells. They multiply asexually and form neomerozoites. These infected red blood cells rupture, which releases even more of these merozoites, which invade new red blood cells, which continues the cycle. So remember, understanding the cycle is crucial for drug therapy because antimalarial drugs target different stages of the parasite's life cycle to effectively kill it and prevent transmission. The erythrocytic cycle is also crucial to understand because it's responsible for the symptoms of malaria, which include fever and chills, due to the periodic bursting of the infected red blood cells. So again, this is cyclic because of the cycle of the rupture of cells. So fever, chills, rigors, diaphoresis, lots of sleeping because the patients are exhausted and they're experiencing what amounts to a hemolytic anemia because of the lysine of their red blood cells. And other common symptoms would include here are listed: headache, nausea, and joint pain. Treatment for malaria isn't started until the diagnosis has been confirmed, and this is for several important reasons. First of all, we need accurate diagnosis. Malaria symptoms like fevers, chills, and headache are similar to those of many other illnesses, so testing ensures that there's the correct diagnosis and that the right treatment is given. And also, different species of malaria parasites require different treatments. So testing will identify the specific parasite, allowing for the most effective treatment. And misuse of anti-malarial drugs can contribute to drug resistance. Confirming malaria ensures that the drugs are used appropriately and only when necessary. And anti-malarial drugs can have side effects. Treating without confirmation can expose patients to unnecessary risks. Further treatment would be guided by which species was identified, how the patient is clinically with the infection, and then of course the susceptibility of the organism, which sometimes we can sort of figure out from the geographical location. As you can see here, that most anti-malarial drugs work in the erythrocytic phase, and you can see we have chloroquine, hydroxychloroquine, quinine, mefloquine, and pyrimethamine, and there's only one that kills the parasite in both phases. Many times these anti-malarial drugs are used together with an antibiotic because of the synergism, and so that we're going to completely kill the offending organism. And you can learn more at the Centers for Disease Control. As we start our conversation about the anti-malarial drugs, it's important to note that some of the first-line treatments that we will use will be chloroquine and hydroxychloroquine. Now, hydroxychloroquine also possesses those anti-inflammatory actions, and so you'll probably be aware that this is used to treat autoimmune disorders like rheumatoid arthritis and lupus. So again, chloroquine and hydroxychloroquine are only effective during the erythrocytic phase, as are quinine and mefloquine. So they work just a little bit different, but they're very similar overall. But basically, it reduces the number of parasites in the blood, alleviates the symptoms, and preventing the progression of the disease. Some of the common side effects or adverse effects of hydroxychloroquine would include diarrhea, anorexia, nausea, vomiting, dizziness, rash, and a headache. So let's go on to the other medications. Dimenopyrimidine is a combination drug, and this once again is effective only in the erythrocytic phase. And a lot of times they'll put it with sulfadoxine or dapsone because of the synergistic effects. Primaquine works in both phases, so this is considered an exoerythrocytic drug, and this binds to the malarial DNA. Sulfonamides, tetracyclines, and clindamycin, these may all be used in combination with the antimalarials because of the synergistic effects. It's common to see quinine and tetracycline used together. And again, just looking over this slide, just remembering that primaquine is the only one of these drugs that we've seen so far that can work in the exoerythrocytic drug phase. So the effects, of course, they're meant to kill the parasites. Hydroxychloroquine, we mentioned on the other slide, also has anti-inflammatory effects. Quinine and quinidine, which we may remember from other lectures that we talked about cardiac dysrhythmias. So quinidine is still used to treat cardiac dysrhythmias, and some of the effects here. So let's look at some of the contraindications. So contraindications of the antimalarial drugs would include an allergy to the medication, anybody with tinnitus, pregnancy is contraindicated in quinine, and of course if anybody has severe renal, liver, or blood dyscrasias. Moving along, most of the adverse effects that we're going to see for these antimalarial agents are GI effects. So nausea, vomiting, diarrhea, anorexia, and belly pain. Some of these can be quite severe. In addition to treatment of an already infected person, if somebody is knowingly traveling to an area where malaria is endemic to the area that they're visiting, prophylaxis can occur. So prophylaxis generally starts 1 to 2 weeks before the potential exposure and then continues for at least 4 weeks after the person leaves the area. A lot of times these medications are very hard on the stomach, so we can take them with food to decrease their GI upset. But otherwise, they do need to be taken with an 8-ounce glass of water. Encourage the patient to contact the prescriber if they have any unresolved nausea, vomiting, any profuse diarrhea, abdominal pain, and report immediately any visual disturbances, dizziness, or respiratory difficulties. The patient should also be educated about what the actual signs of malaria are, just in case their treatment isn't effective. And if we are treating patients with malaria with these drugs, they should also be aware of the signs of a possible recurrence. And remember, that's the fever and chills. And if you go back onto that slide that talked about the malarial signs and symptoms, then you'll have it. So let's take a walk down some protozoal infections otherwise. So amoebiasis, which is also known as amoebic dysentery, is an infection that's caused by the parasite Entamoeba histolytica. I may be saying that completely wrong. It primarily affects the intestines and can lead to severe diarrhea, stomach pain, and cramping. It's often and usually spread through contaminated food and water, poor sanitation, and sometimes intimate contact. It is treated with antibiotics to kill the parasite. Giardiasis or Giardia infection is an intestinal infection that's caused by that parasite called Giardia lamblia. It is one of the most common causes of waterborne disease in the United States. The symptoms of that one would include watery diarrhea, greasy, foul-smelling stools, bloating, nausea, vomiting, loss of appetite. And again, it spreads through contaminated water, contaminated food, person-to-person contact. Pneumocystosis was originally thought to be caused by a protozoa. It's actually caused by a fungus. So sometimes that's why it's lumped in here still. The problem with pneumocystosis is that it's generally, it's basically a serious lung infection that's caused by Pneumocystis jirovecii, but it primarily affects people with weakened immune systems such as HIV or AIDS and those on immunosuppressive medications. And the signs and symptoms would be what you would expect for one with pneumonia: fever, cough, difficulty breathing, chest pain, and fatigue. Now, toxoplasmosis is an infection that's caused by a single-celled parasite called Toxoplasma gondii. It can infect most warm-blooded animals, including humans. And humans, we generally would get this by consuming undercooked, contaminated meat, exposure to cat feces, and also mother-to-child transmission during pregnancy. In severe cases, this can cause severe brain inflammation. Now, trichomoniasis, often called trich, is a common sexually transmitted infection which is caused by Trichomonas vaginalis. There are some signs and symptoms in females. Men are often asymptomatic, but it is spread through intimate contact. All right, so let's go back down to these because we've kind of talked about these a little bit already. So most protozoal infections are caused by and spread by person-to-person contact, unhygienic food and water sources, direct contact with the parasite if it's like, say, in cat stool or something, and then of course insect bites, including mosquitoes and ticks. And people with immune system compromise are going to be at greater risk for these patients and often tend to be fatal. So let's take a look at the drugs. Here's an overall list for some of the medications so that we can start our conversation with them. Let's start with metronidazole or Flagyl. All right, so the first one up on deck is metronidazole or Flagyl. So this is an antibiotic that's also used to treat protozoal infections. So for our patients, it's used for treatment of trichomoniasis and giardiasis. So common side effects are here. Nausea, vomiting, and diarrhea. It can cause urine changes and make them darker, causes a metallic taste in the mouth. And something to remember is the effect of alcohol with this. So inform the patient that taking alcohol while on treatment can cause severe nausea and vomiting. So again, we've talked about metronidazole previously in other lectures on antibiotics. But remember what I said, be careful with metronidazole. It's fragile. So atavaquone or Mepron is used to treat pneumocystis jirovecii. It's also used for other reasons, including prevention of malaria, but it's better if we combine it with something else. Anytime that I've given it, it's generally been treating of PJP or PCP. I don't give this medication that often. When I do, it's generally the oral suspension, and the one thing I can tell you is it is a very yellow medication. But again, for our purposes, it's going to be used to treat pneumocystis jirovecii and sometimes for malarial prevention. This is used basically if the person isn't tolerating Bactrim. Another medication that is used to treat pneumocystis jirovecii is pentamidine. So again, commonly used in our patients with HIV and AIDS, and sometimes used for other things, but generally for PJP. And our adverse effects are listed here. So bronchospasms, you'd want to make sure you're monitoring your patient's airway very carefully. Nephrotoxicity, so monitor their kidney function. Elevated liver enzymes, so please monitor them for signs of liver dysfunction and make sure they don't have liver dysfunction before giving a dose of this. Low blood pressure, pancreatitis, and then some problems with the bone marrow suppression, including leukopenia and thrombocytopenia, and of course many others. So these medications are not for the faint of heart, and they are only used if absolutely necessary. So it's kind of fitting that I'm recording this around Halloween, so we can start to talk about parasitic worm infections. They're also called helminthic infections. So difference between a protozoa and a helminth is that protozoa are tiny and really simple structures, but our parasitic worms, the helminths, they're large and they have complex cellular structure. And the treatment really does depend on the organism. So prior to treatment, it's very, very important to be able to identify what worm is causing which. So this is why we do stool testing, look in the urine, blood, sputum, look everywhere where we think that the infection is, and from there the patient can be treated appropriately. Many of these parasitic worms, because they're found in the GI tract, are spread through contact with areas, pets, and other items that can have exposure to where maybe somebody has already touched their anal canal or otherwise. So this picture right here shows you a tapeworm. You can see it's very segmented, and parts of that tapeworm can break off into segments and then unfortunately are ingested, and that's how you would get that infection. I've changed the picture out now so you can see what a round worm looks like, and you can see it doesn't have the segments like the other one did, much more round, and these are commonly found in our pet friends, our cats and dogs and kittens, and they generally get worms and things like that from getting bit by infected mosquitoes and otherwise that are carrying the ova, or they're infected themselves. This right here is a picture of something called trematodes or flukes, and this is actually found in the blood cells at this time. Basically, it's called a blood fluke. So flukes are actually transmitted by snails, actually. So what happens is that the mature flukes live in the blood vessels of the human intestine, but blood flukes reproduce sexually in the human host, and then fertilized eggs exit the host in the feces, and then the eggs develop in water to these larvae. The larvae infect the snails, and then the snails reproduce, and then the larvae penetrate the skin and blood vessels of humans while they're in water. So these would not be my favorites. But again, the anti-helminthic medications, including praziquantel, would be effective for this. And then, of course, our flatworms. There's actually 25,000 known species, and 80% of them are parasitic and living in water, including marine, freshwater, and even damp areas. They're actually hermaphrodites, so again, many different types, but they all can be treated with our medications that we'll talk about in the next few slides. So praziquantel is something that actually paralyzes the worms, immobilizes their suckers so they can't feed, which forces them to let go of the veins in the livers and then killed by the host. So this is used to treat flukes and some tapeworms, but it should not be used in those with an ocular worm infestation. And this is available oral only. Pyrantel is available over the counter. This is going to be the one that you can see in most of the medications for our beloved pets. Again, but it can be taken by humans as well. So it's used to treat lots of different helminths, including pinworms and roundworms and all sorts of worms. It basically paralyzes the worms and then they pass out through the GI tract. And again, this is available through oral use only. So adverse effects as a class for these medications. So effects vary with each drug, but what is common among all of them would be diarrhea, vomiting, nausea, dizziness, and headache, right? Diarrhea and abdominal pain are very common. So let's look at the nursing implications. So remember, antihelminthics are very specific for their action, so it's really important to identify the cause of the infestation before beginning treatment. Have a thorough history, encourage your patients. A lot of them will have like signs and symptoms, and if they find any of the specimen, they should collect it themselves. Otherwise, we may have to also send stool samples down and otherwise to see if we can identify the causative agent. You want to have baseline vital signs. And then, again, some of the commonly complained of adverse effects and side effects would include that asparagus odor, metallic taste in the mouth, and a lot of GI upset. So most of these are taken with food. All right, so thanks for sticking with me as we journey down some of the sort of invasive freeloaders on our system. And I'm leaving you with this here little cartoon today. So it's kind of cute. It's got some little amoeba or something on the phone saying it's the rubella kid. She wants to know if malaria can come out and plague. And the mom says, "Look, that girl's a bad influenza. Tell her Mally's busy. If she calls back, check the caller ID before answering." Thanks, guys. Have a great day.